This presentation is on meningeal signs, more specifically Brudzinski's and Koenig signs. First up will be the video of myself performing the assessment. Bear with me, I used my husband, so what you see is what you get for this one. Okay, so today we are going to demonstrate Brudzinski's and Koenig signs. First, we're going to test for Brudzinski's. So, Andy, I'm going to lift your neck here, and when I lift your neck, you let me know if anything hurts, and we'll go from there. Okay? I'm gonna place my hand under here, lift your neck, and here we have demonstrated a positive Brudzinski sign. His legs and his hips came up involuntarily. Lay your head back. Straighten out. And this time we're going to demonstrate what a negative Brudzinski sign is. And nothing happens. Very good. Now. Okay, and next up we'll do Koenig sign. So I'm going to lift your right leg here. First we're just going to get your leg off the floor. So you can bend your knee here. Lift with me. We're just getting your hip up a little bit. Okay, and now I'm going to attempt to straighten your leg, and you let me know if you have pain or when I should stop if it starts to hurt too much, okay?
Ow.
Okay, so here is a positive Koenig sign. You can see we weren't really able to extend the leg more than, honestly, this is only a little over 90 degrees.
Ow!
Okay, sorry. We'll lay it back down. Okay, and now stop. And now we will demonstrate a negative Koenig sign. So we'll lift your leg again. You can bend your knee here. We're going to lift your leg just to get your hip off the floor. And then we'll straighten it. It's a little heavier than a small child. And no pain there, correct? So that's a negative Koenig sign. Okay, so there was the video on how to perform both of those signs. First, we'll talk about the technique. So, Brudzinski's, you flex the patient's neck while they're lying supine. If the hips and knees flex automatically, then we would say that's a positive Brudzinski sign. If the hips and knees do not flex, they kind of just stay there, that would be negative. For Koenig sign, again, the patient is lying supine. You lift their leg up to get their hip off the floor at about roughly 90 degrees or so. And then you attempt to straighten that leg or extend that leg. If it is a positive Koenig sign, the patient will likely experience pain as you start to extend the leg, and you likely will not be able to get it fully straight. Most times it can't even get past like roughly 135 degrees. If there is no problems as you're extending it or no pain in the hamstring, then Koenig sign is negative. So why do we use these signs? Both Brudzinski's and Koenig signs are assessment tools that we can use at the bedside to assess for meningitis. If, like I said, if they're both positive, or even if one is positive, it can be indicative of meningeal inflammation, but neither in present day is a diagnostic test to just solely confirm it. Like I said, it can be indicative, but further tests would need to be done to confirm meningitis. So different clinical scenarios, a patient could come into the emergency room. It's common more in pediatrics. They may have had a sudden high fever or this severe headache, have sensitivity to light, stiff neck, confusion, seizures, sleepiness. If it's an infant, they may have a lack of interest in feeding, may be really fussy, or just sleeping a lot. So if a patient comes in with, some of those symptoms, all of those symptoms, then Brudzinski's and Koenig's can be performed, like I said, right at the bedside to just assess for further likeliness of meningitis. So here is a picture of Brzezinski's sign, which again you saw in the video, but just to have kind of a standstill. The first picture is the position that the patient or child would lie in, and then the second picture is as the caregiver, extends the neck, flexes the neck, then you see the hips and the knees coming up as well. Next, we have a picture of Koenig's sign, which again was demonstrated in the video, but this is a good standstill. So patient lying supine as well. You lift, one leg to get the hip off the ground. And once you try and press on the knee where the caregiver has her left hand, if you start to have pain as you extend that leg, or you really can't get beyond, 90 to 135 degrees, that could also be a positive Koenig's sign. So technique. Well, we just talked about the technique to perform it, but we'll talk about some tips and things. While there aren't really any physiological landmarks in performing these, because it's mainly with the legs for Koenig's sign and the neck for Brzezinski's, it's not that you have to assess at a specific area. There are certain things that you can do to ensure more accuracy and just like some tips to help with the assessment. So as mentioned, for both of them in present day, we have the patients lying supine. For Brzezinski's, it's important that when you're flexing the patient's neck to watch the feet and hips. While this demonstration showed a very clear response with the hips and the knees, that may not always be the case. So just kind of keep your eyes down there. You'll notice in the video how I kept an eye on both the legs when I was flexing the neck, just to see their response. For Koenig's, as mentioned, the hip first needs to be flexed to 90 degrees. And when you are attempting to extend the leg, be sure to assess for pain. Pain is pretty indicative of a positive sign. And then also pay attention to the angle at which you are able to extend. Some people don't have the flexibility to extend the full way regardless. So it is important to kind of keep an eye. And as I mentioned, most patients aren't able to straighten more than 135 degrees if it's a positive Koenig's sign. So anticipated findings with Brzezinski's, a normal finding would be that nothing happens with the flexion of the neck. That would be a negative Brzezinski sign and likely not indicating meningitis. Koenig's, when you lift the leg, the patient will be able to extend it and they won't experience pain as you progressively extend that leg. Also indicating a negative Koenig's sign, likely negative for meningitis. So abnormal findings or positive Brzezinski's and positive Koenig's signs were demonstrated in the video. The hips and knees for Brzezinski's automatically flexed when the neck was flexed, and Koenig's, the leg could not be completely extended and it was painful. So why do those responses occur? Brzezinski's, it is thought that passive flexion of the neck stretches the nerve root through the inflamed meninges, leading to pain and flexion movements of the lower extremities. This response is caused because there is increased traction on the spinal nerve roots. So when the knees and hips flex, that causes increased relaxation to decrease the painful stimulus that they're experiencing when you flex their neck. Koenig's, originally it was thought that muscular hypertonia of the lower limbs as well as physiological predominance of the extensor muscles of the neck and back over the flexor muscles of the lower limbs is the basis for it. But eventually it was thought to be a protective reaction to the pain or spasm of the hamstring muscles induced by the stretch of the inflamed and hypersensitive nerve roots. Thus why it's so painful when you attempt to extend their leg. Some further assessment, since both of these techniques assess for meningitis, additional questions should be tailored to common features of meningitis. How old is the patient? Have they had a fever? If so, how long? If they have a headache, what's that headache like? Is it severe? Is it throbbing? Is it unlike any other headache they've seen? For infants, most times they will just, scream because it hurts so bad. Is there sensitivity to light? Any stiff neck, confusion, any seizure activity, any difficulty arousing or excessive sleepiness, nausea, vomiting? Some abnormal vital signs that can be expected are, of course, the increased temperature, but also increased in heart rate and increased respiratory rate. Infants may have a lack of interest in feeding. Diagnostics for meningitis include a spinal tap of cerebrospinal fluid and some lab work that can be done. Likely they'll have an elevated white blood count, maybe a low blood glucose, and then also increased protein. And here are my references. The first and third ones listed were just for the 2 pictures I included, and then the second one was where I got most of my information from.